According to American Heart Association, there are 5 main blood pressure ranges. 1. Normal blood pressure is 120/80ths of a millimeter of Hg. 2. If blood pressure is 139/90ths of a millimeter of Hg is prehypertension. 3. If blood pressure is 159/99ths of a millimeter of Hg is high blood pressure stage 1. 4. If blood pressure is 160/90ths of a millimeter of Hg is high blood pressure stage 2. 5. If blood pressure is 180/110ths of a millimeter of Hg is high blood pressure is hypertensive crisis, it is emergency. High blood pressure stage 1. High blood pressure stage 2. Hypertensive crisis stage 3 emergency. According to Harvard Health and Medical School. Citrus fruits. Citrus fruits, including grapefruit, oranges, and lemons, may have powerful blood pressure lowering effects. They're loaded with vitamins, minerals, and plant compounds that may help keep your heart healthy by reducing heart disease risk factors like high blood pressure. Beating high blood pressure with food. 10 tips for using diet to control blood pressure. Fiddling with diet to control cholesterol makes perfect sense. After all, some of the cholesterol that ends up in arteries starts out in food. Changing your diet to control blood pressure doesn't seem quite so straightforward. Yet food can have a direct and sometimes dramatic effect on blood pressure. 10 tips. Drugs that lower blood pressure tend to work well. But they don't necessarily attack the cause of the problem. And no matter how safe they are, all drugs can have some unwanted or unintended side effects. A healthful diet is an effective first-line defense for preventing high blood pressure. It is an excellent initial treatment when blood pressure creeps into the unhealthy zone, and a perfect partner for medications. Unfortunately, translating the dietary strategies tested in clinical trials into diets for daily life hasn't been easy. Here's evidence-based advice about diet and blood pressure, complete with a weekly shopping list, see below. Eat more fish, nuts, and legumes, beans. Try to burn at least as many calories each day as you take in. Turn to vegetables and fruits instead of sugary or salty snacks and desserts. Select breads, pasta, and other carbohydrate-rich foods that are made from whole grains instead of highly refined white flour. Eat fruit instead of drinking fruit juice. Use unsaturated fats like olive, canola, soybean, peanut, corn, or safflower oils instead of butter, coconut oil, or palm kernel oil. Rely on fresh or frozen foods instead of canned and processed foods. Choose low-sodium foods whenever possible. Use herbs, spices, vinegar, and other low-sodium flavorings instead of salt. Decrease your caloric intake if you need to lose weight. If you need help, record everything that you eat day by day for a week. Have this information reviewed by a dietitian.